Hi everyone. Hi everyone. Today we are going to see an important topic from immunology, hypersensitivity reactions. Hypersensitivity, the term intolerance, refers to undesirable reactions produced by the normal immune system, including allergies and autoimmunity. They are usually referred to as an overreaction of the immune system, and these reactions may be damaging, uncomfortable, or occasionally fatal. Hypersensitivity reactions require a pre-sensitized state of the host. Hypersensitivity is increased reactivity or increased sensitivity by the animal body to an antigen to which it has been previously exposed. The term is often used as a synonym for allergy, which describes a state of altered reactivity to an antigen. Causes of hypersensitivity: autoimmunity, reactions against self antigens, reactions against microbes, reactions against non microbial environmental antigens. Types of hypersensitivity reactions. The Gels and Coombs classification of hypersensitivity reactions considers four types of reactions. Type 1: immunoglobulin E mediated. Type 2: antibody mediated cytotoxic hypersensitivity reaction. Type 3: immune complex mediated hypersensitivity reaction. Type 4: reactions are called cell mediated hypersensitivity reactions. Type 1: IgE mediated. Antigen like insect venom, foods, pollen, and dust mite induces cross-linking of immunoglobulin E bound to mast cells and basophils with release of vasoactive mediators. Typical manifestations include systemic anaphylaxis and localized anaphylaxis such as hay fever, asthma, hives, food allergies, and eczema. Exposure to an allergen activates B cells to form IgE secreting plasma cells. The secreted IgE molecules bind to IgE specific Fc receptors on mast cells and blood basophils. Second exposure to the allergen leads to cross linking of the bound IgE, triggering the release of pharmacologically active mediators, vasoactive amines from mast cells and basophils. The mediators like histamine, kinogen cause smooth muscle contraction, increased vascular permeability, and vasodilation. Type 2: antibody mediated cytotoxic reaction. IgG and IgM antibodies are directed against antigen on cells or extracellular material, leading to cell damage. Type 2 involve IgG or IgM antibodies bound to cell surface antigen with subsequent complement fixation. The immunization of individuals to erythrocyte antigens during pregnancy is a typical example of type 2 reaction. Children who inherit the RHD erythrocyte antigen from their father can induce immunization against the RHD plus antigen in their RHD minus mother. Sensitization usually occurs at birth when fetal blood cells come into contact with the maternal immune system. In any subsequent pregnancies, maternal anti-RHD antibodies of the IgG type can pass into the placenta and cause severe hemolysis of fetal RHD plus erythrocytes. These are medically known as erythroblastosis fetalis. Other examples like drugs can passively bind to erythrocytes, antibodies directed against penicillin then lead to lysis of erythrocytes. Type 3: immune complex mediated reaction. Antibody antigen complex can form during an immune response. Immune complexes can settle in vessel walls, the basement membrane of the lungs, kidneys, and in the joints. They can induce inflammatory processes in these structures by binding complement factors C3A and C5A, which are known as anaphylatoxins. A particular type 3 reaction is the Arthur's reaction, when an antigen has penetrated the skin of an individual who has preformed IgG antibodies. The immune complexes can bind to Fc receptors of most cells, inducing degranulation. Inflammatory cells are recruited and complement is activated, leading to the release of C5a and local inflammation, platelet accumulation, and eventually to blood vessel accumulation and necrosis. Type 4 hypersensitivity reaction. It is otherwise known as delayed type hypersensitivity reaction. Common IR that occurs through direct action of sensitized T cells when stimulated by contact with antigen. When some subpopulations of activated Th cells encounter certain types of antigens, they secrete cytokines that induce a localized inflammatory reaction called delayed type hypersensitivity. It needs an incubation time about 12 to 24 hours. Two phases are there. Sensitization phase and effector phase are followed in delayed type hypersensitivity reaction. This picture shows the overall view of type 1, type 2, type 3 and type 4 hypersensitivity reactions. So in this lecture we have seen hypersensitivity reactions overview. In next video we will see some new topics from immunology. Thank you.